The House of Representatives is in recess, and Republicans are planning to spend the summer break putting the heat on Democrats. Now, according to one GOP leadership aide, the party's strategy on health care is really simple. Quote, capitalize on the anxiety of the voter base, just ram it down their throats and knock their teeth in. Republican Congressman from New York, Peter King, joins me now. Congressman King, good to hear you. Good to see you, rather.
Good to see you, Carlos.
So that's pretty tough language. Is there a sense among your fellow Republicans that momentum is swung in their favor? And if so, what does that mean from a policy perspective?
Yeah, I think it's pretty clear that over the last month, momentum has swung in our favor. But, you know, we have to avoid too much hubris. We have to avoid, I believe, going for the kill. What we have to do is make our case, try to make it cogently and effectively, that the president is overreached, that he is attempting to, totally reform or change a healthcare system without really an idea of where he wants to take it. I mean, there are 4 or 5 different proposals out there, and, this is not a major issue among the American people. I think the last poll showed 14% see healthcare reform as being a major issue, yet this could have a real impact on the American people. So that's why they feel, I think this is a metaphor for the president having gone too far too fast and really not lived up to his campaign promises of governing from the center. But we have to avoid acting as if, we've won this battle. Right now, the voters are turning somewhat against Barack Obama. It doesn't mean they're coming toward us. We have to play this, I believe, very effectively, but not be going for the kill. We're just laying out our plan and why we think the president's wrong.
Congressman King, we push you on that, though, because that's, what you just said is fairly provocative, to say the least. The polls I've seen say that north of 60% of the voters think that this is an important issue that needs to be addressed. And in fact, no less than a conservative stalwart, Robert Bennett, the senator from Utah, says that Republicans, among others, are going to pay the price at the ballot box if there isn't major health care reform. He disagrees with President Obama on what it should look like, but he says that it's a must. Are you saying that this is not a critical issue? Are you saying that major health care legislation doesn't need to get passed this fall?
Yeah, what I'm saying is that when you ask the American people what's the most important issues to them, health care reform does not rank high. Now, if you ask Americans, do they want health care reform, they will say yes. But then when you talk about what health care reform means, it's not, I believe, what President Obama wants. I think there's approximately maybe 10 to 15 million people who are not going to have health insurance under any circumstances. We should be focused on them. We should also be looking at issues like portability, where you can take your insurance from one company to another, where we would give subsidies to those who really can't afford it. We would allow small businesses to form consortia so they can get better rates on their insurance policies, but not this overall government plan. I still believe we have the best healthcare system in the world. We can adjust it and modify it, but not radically change it the way the president wants to.